Do you often feel like you can't throw anything away, even old newspapers or broken pens? What if your room gets so full of stuff you can't even walk through it? That might be more than just being untidy. It could be hoarding disorder. Imagine loving your coffee mug so much that you keep every single one you've ever used, even if they're cracked or dirty. Now imagine that with clothes, boxes, bags, and even trash. Hoarding disorder isn't about collecting cool stuff. It's when saving things, even useless ones, causes real trouble in life. People with this disorder feel extreme fear or sadness at the thought of losing or throwing things away, even if they're not valuable. So why does someone start hoarding? It usually doesn't happen because of laziness. Think of your brain like a computer. For people with hoarding disorder, the delete button isn't working well. They might believe, what if I need this someday? Or this might be useful later for things like empty bottles or old flyers. Sometimes it starts after a tough life event like losing someone or going through trauma. For example, someone who lost their home in a fire might start keeping every item just in case. Other times, it runs in families. Maybe your parents saved everything, and you learned to do the same. Brain scans show the part of the brain linked to decisions and emotions works differently in hoarders, making letting go feel painful. How do you know if it's more than just messy? Let's play a quick game. Picture your room. Can you sit on your bed without moving piles of clothes? Is every drawer crammed so tight it won't close? That might be a sign. People with hoarding disorder often collect things like old magazines, broken electronics, or even trash. They feel strong emotions when asked to toss something. They might say, but it's still good, or I might need it one day. Over time, their home gets unsafe, exits blocked, piles high, pests attracted. It's not just physical clutter, it hurts relationships too. Friends stop visiting, family gets worried. Some people even feel ashamed and hide what's happening at home. The key sign: saving stuff causes stress, danger, or stops them from living normally. Can it be treated? Yes. But it's not like taking a pill and boom, fixed. It's more like learning a new way to think. A mental health expert, like a therapist, talks with the person to understand their beliefs about saving things. They might gently practice letting go, starting with something small, like a single piece of paper. This is called CBT, or cognitive behavioral therapy. It helps change how someone thinks. This pen cap isn't useful, and acts tossing it. Medicines like antidepressants sometimes help, especially if the person also feels anxious or sad. The key is going slow and not forcing. Pushing someone can make it worse. It's like helping a friend afraid of water. You don't throw them in the pool, you help them inch closer. Can we stop hoarding before it starts? Not always, but we can help reduce the risk. If you notice yourself or a loved one keeping too much stuff and feeling stressed about it, talk about it early. Think of it like fixing a leaky faucet. Small leaks can become floods. Teach kids the habit of sorting, keep, donate, toss when cleaning their rooms. If someone goes through a hard time, like a breakup or job loss, check in. Emotional pain can lead to emotional clutter. Setting small habits like clearing one drawer a week keeps clutter from building. Prevention isn't about being perfect. It's about staying aware and kind to yourself. Scientists are learning more every. Recently, researchers found that online shopping makes hoarding worse. It's so easy to click buy and never stop. Some new apps now help people track what they buy and set limits. Brain studies show that during therapy, activity in decision-making areas of the brain can improve, meaning the brain can relearn to let go. There are even home visits by therapists, where they walk through the house and guide clutter clearing in real time. Another exciting idea: support groups with people who have been through hoarding. Sharing stories helps reduce shame. One study showed that after group therapy, people not only cleared space,